what is cardiovascular disease risk, or QRISK? Your healthcare provider might want to talk to you about your cardiovascular disease risk. This is sometimes called QRISK. Cardiovascular disease includes angina or heart attacks, sometimes called coronary or ischemic heart disease. It includes strokes, mini-strokes or TIAs, aortic or peripheral vascular disease. Your QRISK estimates the likelihood of you developing cardiovascular disease over the next 10 years. Your QRISK is calculated based on your age, sex, ethnicity, weight, height, whether you have ever smoked, whether you have diabetes or high blood pressure, this is called hypertension, or if you have high cholesterol or chronic kidney disease. Or perhaps one of your relatives has ever suffered with angina or had a heart attack before the age of 60. Your healthcare provider will give your QRISK as a percentage, which is the likelihood of you having a cardiovascular event in the next 10 years. The bigger the percentage, the greater your risk. Whatever your risk is now, it will only increase as you get older. For example, if your QRISK is 20%, then in a crowd of 100 people with the same 20% QRISK as you, over the next 10 years, we would expect that 20 of them would get heart disease or have a stroke or a TIA, and 80 would not. And sometimes those 20 events can lead in death. But we cannot say for sure what will happen to any specific person. 20% or 1 in 5 is considered a high QRISK. However, even a 10% QRISK, i.e. 1 in 10 chance of having a stroke, a TIA or heart attack in the next 10 years is still very significant. And your GP or nurse may recommend that you start a tablet called a statin. The most commonly used statin is called atorvastatin. Other statins include rosuvastatin and simvastatin. Your GP practice will also support you to start making healthier changes to your lifestyle.